Officials in Ottawa are taking action to try to stop a potential outbreak of measles.
The re-emergence of certain vaccine-preventable diseases is being seen across the world, and it is cause for concern.
Officials with Ottawa's Public Health raised concerns. They had a meeting of the health board last night, and they raised concerns because of the timing. March break just around the corner. You heard that reference. Global vaccination rates have dropped during the COVID-19 pandemic for a number of commonly treated illnesses. Measles, in this particular case, those telltale rashes, fever, cough, but in 10% of cases of measles, there can be complications, including pneumonia and encephalitis. Let's bring in Dr. Samir Gupta. There's a starting point for our conversation with Dr. Gupta this week, a respirologist and an associate professor with the University of Toronto's Department of Medicine. Morning, Dr. Gupta.
Morning, Heather.
I'm wondering the timing of this. It was interesting, just the start of March, but looking ahead to March break, more mixing, more travel. So Ottawa's Public Health warning about the potential for a resurgence of measles, and they're putting together a team to get set for any potential outbreaks. Why are we seeing a resurgence of measles, Dr. Gupta, and what should parents know?
Yeah, so the why is similar to, I think we talked about polio coming back, and, we've heard in the last few years of outbreaks of mumps, and these are all diseases that we had largely conquered with very effective vaccines, but vaccine uptake has been going down, and that was happening before the pandemic. And then, as you heard in that report, a lot of people missed their vaccines. A lot of kids missed routine immunizations during the pandemic just because of disruption with access to health care. In some cases because of increasing vaccine hesitancy. And so when you have a whole bunch of children, millions around the world, who are not vaccinated against a disease like measles, you will see this disease coming out. And there are outbreaks around the world. So that's probably the why. And hopefully we can catch up on that and get folks immunized again. And then in terms of what parents should be concerned about, it's what you said. And the tricky thing with measles is that it behaves like any viral illness at first, with sort of cough, runny nose. You do get runny eyes as well. But then you have this rash, which is, as you showed it there, it's a telltale rash. And that's when you start thinking, oh, this is something different. But unfortunately, you are often infectious, contagious for several days before the rash appears. And then, of course, for several days thereafter. And it's an extremely contagious virus. This is why it's so hard to contain this in terms of outbreaks once it occurs. And if you have pockets, and we've seen it in pockets of communities, religious communities or cultural communities that have low vaccine uptake, then there is that locally low herd immunity. And it can spread very quickly in those pockets, in those communities.